Hi, it's Dr. Diana, and welcome to our second monthly Facebook Live at Amazing Over 40 Women's Wellness. I am Dr. Diana Hoppe. I am the host of Amazing Over 40 and also the creator of Amazing Over 40. And I'm really looking forward to all of your questions because these are times that you can ask me any questions. It could be about beauty today or hormones or whatever you want to ask. I'm here for you. For those of you who may not know me, I am a board certified OBGYN here in San Diego, California. And I specialize in perimenopause and menopause. So that's my real passion. I also love to educate and go on retreats with friends and patients and anyone who wants to join me. So actually next week I'll be going to Italy for my Italy trip. So those of you that are coming with me, brava, brava, because that's wonderful. And let's see if there's any questions. Also, if you when you join, please let me know where you're joining from, and if you have any questions, that would be awesome. So this week's topic is about beauty inside and out, and how do we really look and feel our best after 40. So the blog post is ages beauty, want ages beauty after 40, and I really focus on basically what are 6 tips that can help us keep our skin looking our best, because we know that when we look in the mirror sometimes we might have more wrinkles, and as we know, this is a absolutely normal part of aging. It's natural. Our skin loses some collagen, it loses the elastin. It can have a lot of different things that happen over time, and we really like to minimize those. So I'm going to put in the chat box, please say where you're coming from and any questions. And any questions. If I could type, that would be great too. Alrighty, there we go. Alrighty, enter. Alright, cool. Alright, so I need to know the chat box is working. So in this blog post, I talk about 6 tips that are really going to help with beauty and keeping our skin looking the best. And we know with perimenopause and menopause, our hormone levels fluctuate in perimenopause, and then in menopause they basically decline, so our estrogen levels drop and our progesterone levels really drop, and this can have effects like hot flashes, night sweats, mood swings, irritability. So those of you who've been to my other Facebook lives, you've heard a lot about these, and I will continue to talk about how we can best manage those symptoms as we go through this. But with menopause, our levels of estrogen and progesterone drop remarkably low, and this affects our skin. So our elastin and collagen will decrease by about 30. And that's in addition to just the regular aging that we have as we get older. So we have Kim, good evening from Virginia. Awesome. Kim, great. I'm so glad you're with us. So what I've noticed is that I think that sometimes we don't tend to take the best care of our skin. And I will say that I am a culprit of such a thing, and that sometimes I don't always follow my own medicine. Sometimes that happens, right? So the first thing on the list of things I had in the blog is increase the amount of moisturizer that you use, because our skin needs more moisture as we get older. It needs to have kind of like water content to expand and really hold on to, let's say, some of the creams that we use, some of the other serums that we use. So it's really important that we use a really good moisturizer. And one of the ones I like the best is the CeraVe. So every night I put that moisturizer on because I really think it helps my skin. There's many other moisturizers out there. I do it morning and night because I think that that's important to be hydrated with the skin, because during the day we're faced with all the things that affect our skin, like pollution, air pollution, the toxins potentially maybe in our makeup, and etc. So we really need to make sure we moisturize our skin. That's the first thing that we do, as well as the last thing we do when we go to sleep. Another thing that's important is to cleanse. So we need to wash our skin and strip out some of the exfoliation of our skin. And sometimes some of these cleansers can have really harsh chemicals. So it's important to use a very gentle moisturizer and a gentle cleanser, excuse me, as well as a moisturizer, but a gentle cleanser. So that would mean you're not going to use something really harsh on your skin. You're going to use it gentle, so it will exfoliate, lift off those kind of older skin cells that need to be taken off so that the new skin cells can now be coming out. So we need to get some of the pores unclogged, make sure your skin is clean, so that right before you put your makeup on, etc., you have good, clean skin. Another point that I make in this blog post is about being patient. Sometimes we want the quick fix, which I get, believe me. We want a pill or we want a cream and just say, just make my skin look beautiful and just give me this one thing I need to do. Well, as we know, as we get older, we have to really maintain our health and we have to do potentially more than we did when we were younger, right? And if any of you agree with that, please just chime in the chat box and say, yes, totally agree with you. So we need to be more patient in that we have to figure out what works best for us. So what works for our neighbor or our sister or our best friend may not be exactly what works the best for us. So it really takes some time to realize what's the best moisturizer for you, what's the best cleanser. And as we discuss other things, it's really important to see what works for you. And I mention this with regard to all parts of menopause and perimenopause because you are unique. What you need is different than what other people may need and other women in your life. And that also pertains to hormone therapy. So it's not like a cookie cutter type thing. We have to figure out what works best for you. And that's not just with skincare, but also, let's say, hormone therapy and other things that we might consider to use as we're getting older. Also, it's really important to use a broad spectrum sunscreen. So I can also still be a culprit of this in that I play a lot of tennis. I've been getting better at putting the sunscreen all over my face and then on my chest and my arms. But I still sometimes don't put it my whole body, which really I should do because that's going to help prevent skin cancers, the different cancers that come from the UVA and UVB light. So we want to really protect our skin, and that would be from a good broad spectrum sunscreen. And normally it should be at least 30 or higher. And we should really start doing this even in our younger years because it's going to help prevent skin damage as we get older. But again, even as soon as your children, like if your kids are young, have them start using sunscreen. Make sure it's broad spectrum, and make sure that you reapply after they go in the water, as well as you go in the water and the beach, etc. So it's really important to use a really good sunscreen. And one of the ones I like that has very few toxins and preservatives is the Badger. It's a clear zinc sunscreen, and that's in the blog post because in certain sunscreens there could be a lot of chemicals, and certain chemicals are not good for our skin. So it's important when we put makeup on, when we put sunscreen on, that we are using things that have less preservatives, are paraben-free, don't have a lot of toxic chemicals, because our skin's going to absorb those. So we know about transdermal absorption. That means through the skin. So if we're using a sunscreen that has a lot of chemicals in it that are potentially harmful to us, we might be doing more harm than good. So I chose this one because it is reef friendly, so it won't affect the coral reefs and the Great Barrier Reefs and all the animals that we like in our coral, etc. It also is broad spectrum, water resistant, it's organic, ingredients and natural minerals, especially zinc. So zinc is really important for our sunscreen, so that I have good zinc there. Another tip I have is to use a retinol cream. And this should be done at nighttime. Really important because you don't want to be putting retinol type of serums during the day because it makes your skin potentially more sensitive to the sun. So it's important after you cleanse your skin and you put your retinol cream at nighttime, not in the daytime, because you don't want to cause hypersensitivity to the sun, like I just mentioned about sunscreens. And then another thing, the last point I really make is about hydration. We really need to make sure we hydrate. And this is, again, I think I preach this almost every Facebook Live that I do. We need to make sure we drink enough water. And water can also be in the foods that we eat, like watermelon, lettuce, etc. But we really need to drink at least half of our body weight in ounces of water per day to keep our bodies hydrated. And this is not just our skin that needs to stay hydrated, but also our brains. So in one of my previous blog posts, I wrote about the brain being at least 80% water. Some parts of the brain even higher percent water. So if you don't have enough water, this can lead to headaches, a lot of mood swings, irritability, other things, but also it can cause problems with your kidney function. I mean, so many things have to do with hydration that please hydrate. Drink at least half your body weight in ounces of water, And if you're doing a lot of strenuous exercise, please add electrolytes to to the more water that you're drinking, because you need to replenish that sodium chloride that's in your sweat that is lost with really excessive sweating, which is good to sweat because we release toxins. It's actually really, really good for our skin to release those toxins. So sweating is good, but you also need to replenish some of those electrolytes that you're losing. And also, if you're drinking a lot of water, we don't want to get what we call hyponatremic. That means too much water and then your sodium level will go down. So we want to make sure that we drink enough water, but also replenish the electrolytes when we need that. So please feel free to put in the comment section anything that you want. I'm hoping that we can, let me see if I can expand this. Because I know I just saw another comment come through. So I will see if this goes down. New comments. Here we go. Alrighty. So perfect. One of the things I want to add to this discussion, which I think we all would be interested in, is that about collagen peptides. You hear a lot about collagen, right? And you're like, oh, collagen is good for our hair, our nails, our skin, and many things, right? So I investigated about, well, what is collagen powder? What's the best collagen powder? And what do we need to look for in collagen powder? So the main thing is it has certain types of collagen in it. And the one I like is the collagen peptides made by Live Conscious. Now, I'm not affiliated with this company. I just researched it and found that I thought that the ingredients were the best, and it also was very bio-friendly to the environment, GMO-free, preservative-free, etc. So if you have a certain collagen peptides that you like to use, please share them with our group here, but they can be really important, and you want peptides. Because if you put collagen on your skin, it's a very big molecule, and that will not be absorbed transdermally. So it won't be absorbed through your skin because it's such a big molecule, it won't go through. Now, if you want to cover up some fine lines and wrinkles, that's great because it's almost like a face putty to make you look really nice. But if you really want to build it out from the inside out, you need to have the collagen peptides and also have water so that that collagen can actually activate in your skin. Also vitamin D, vitamin C, vitamin A. There's certain lot of vitamins that are good for our skin and hair also, vitamin D being one of them. But vitamin C is needed to make collagen. So when you have these things you're looking at, please make sure that you include all the things, and that would be in a good diet. So when we think about what's the best diet, and I don't really like the word diet, but it's really what's the best nutritional system that we can use, or what can we follow, and it's really the Mediterranean diet. That's the one that's been shown to really help glucose levels, decrease diabetes, decrease high blood pressure, and help us live the best lives. So the Mediterranean diet is the best diet. That means lean protein, very little amounts of meat, but you can have fish, chicken, etc. But lean meats, also a lot of fresh fruits and vegetables, and a reduction in stress. So that's actually why I'm going to go to Italy. Italy is one of my favorite countries. I'm going next week, and I love the Mediterranean diet with the olive oil, which is again good for our cardiovascular health, and how they approach life is such a fun way for us to actually see how we can maybe change the way we do things here in America. So if any of you have any questions, please feel free to ask, because that's why I'm here. This is the time for you to help me answer what's important for you. So this is the time that you can ask Dr. Diana, the founder of Amazing Over 40, a specialist in menopause and perimenopause, anything you want about hormone therapy, oh my gosh, anything, women's health. I am the women's health expert. I really have put a lot of time and effort. I've had over, 25 plus years of clinical experience, and I've made the Amazing Over 40s website so that all of you have access to incredible information. The information that's up to date, it's trustworthy, it's good information so that you know that you can trust and believe it, and it's based on real data. So sometimes we go to certain things on Google or certain sites and we may not know exactly where it's coming from, and how do we know that this is something we can build, besides trust, but really have faith in, right? And so that's where I put a lot of interest and time into my Amazing Over 40 site. So if you have friends that want more information, please, please have them go to the Amazing Over 40 site, read the blog posts. There's a lot about perimenopause, menopause. There's recipes I have that are really cool. I love trying new recipes because I like to cook when I actually have time. I like to cook and then share the recipes that I can share with you. And I also love to travel. And so that's where Teresa says, are you getting any negative side effects to the collagen? No, I'm not having any negative side effects. I've been using it now for probably a few months, and I'm noticing my nails get stronger, my hair is stronger, my skin. My skin, I think, is better, but it's hard because I see my skin every day, so it's kind of hard. And I'm a bad person about taking before and after pictures. So if you do have your own collagen that you like to use, and you want to do like before and after pictures, please do that, because then you can see how the collagen powders, the collagen peptides are helping with your skin. And I really don't find any negative side effects from it. Again, these are collagen peptides, so if you're putting collagen on your skin, it won't be absorbed transdermally, but the collagen peptides, I didn't have any nausea, no side effects that were in any way problematic. I mean, I didn't have any side effects, and what I noticed is a little more energy, a little better hydration, and better nail health and better hair. So those are all important for collagen as well as for skin. So great question. Thank you, Teresa. And thank you for saying have a great trip. I really appreciate that. Does it help joints? Yes. I was focusing so much on beauty, I was not thinking about the joints. And yes, collagen can help with joint pain. Also, glucosamine, chondroitin sulfate, and MSM, which is another molecule that is really good for joints. So that's an important point. So if you have joint pain, collagen is definitely important, as well as the chondroitin sulfate, I mentioned the glucosamine, and MSM. The other thing that's really important for joints as well as for our brain health is omegas. That is the EPA and DHA. Those are known as fish oils, or omega-3 fatty acids. You can get this in salmon, you can get this in lots of foods. I actually like to take it with Metagenics. That's one of the products that I do get some credit for. It is on my site, the Amazing Over 40 site, under products, and it's Omegagenics EPA DHA 1000. So that's what it looks like. You can order it online with me. I will get a slight percentage for that. And it has a lemon flavor. It does not cause any burping, of any like fish or burping type thing that some of the omegas can do. And it's just one a day, which I like too, because I like to keep it simple. I have a busy practice. I don't want to make it too complicated, and that's why with my skincare routine, I also try to keep it simple, because I know sometimes we get all these moisturizers and serums and da 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 da, and I'm like, okay, I don't think I can do half an hour before I go to sleep of all the stuff. So I try to really make it more streamlined and easy. So I think what I'm going to do is probably add another blog post down the line in a few weeks about what my skincare regimen is, if people want to know that. And then again, it has to be individualized. So what works for me may not be exactly what works for you, but having some kind of concept of what needs to get done every day in the morning and the night can really help make us feel and look better, because that's the goal of Amazing Over 40. And my goal is to educate you, to inspire you, to make you, allow you to see that there's a lot of life after 40, 50, 60, 70, and beyond. I think many of you may know that I'm turning 60 this year, which is kind of crazy because I never thought I'd get to 60, but I am going to be 60. So that's going to happen in November. And that's really important for all of us, to be our best at 40, 50, 60, 70, and beyond. And that's what Amazing Over 40 is all about. So any other questions, please let me know. Teresa, thanks for that question about the joints. Definitely collagen can help. The other thing is the omega-3 fatty acids. And the omega-3s also help with cardiovascular health. So I think many of you who read my blogs will know that the main cause of death, so what women die from in America and the United States today, is heart disease. It's not cancer, it's heart disease. Cancer is number 2. And that is all the different cancers together, lung cancer, breast cancer, etc. But the main cause is cardiovascular disease. So cardiovascular disease is accountable for about 1 to 2 of deaths of women in the United States. So it's really important for us to exercise, to eat right, to have the omega-3 fatty acids, get them through our diet if we can, or through a supplement. And make sure you get at least 4 to 5 workouts per week. Sometimes they say it's 130 minutes or 150 minutes. It's really, if you can do something every day, it could even be walking, that's really important because it also helps your joints. So the more movement we do, the better our joints feel. So some of you may also have this that I have. When I get in the morning, I wake up and my joints can be a bit stiff. You can say hi if that's true for you, or wave, or give me a little signal, but I'm noticing now as the years go on, my joints are a little more stiff when I wake up in the morning. So it's important to get moving. Moving is really important for our cardiovascular health, for our joints, for our balance. So Tai Chi is one of the exercises I really love because it's great for balance, it's good for strength, it's weight bearing, so that helps your bones. Really important to be weight bearing to help the bones stay strong. And it helps engage all different types of muscles. Your brain has to work to do the balance and the exercises. It's a really cool thing. So if you look at Tai Chi, it's the best, one of the best exercises to keep balance, to keep healthy. It's also a stress reduction. So many of you know how much I talk about stress. I know what stress does to our lives. So if we can decrease the stress in our overall life, be it whether our jobs, our relationship, the stress with our families, sometimes we have aging parents. So I'm hydrating. If we can manage stress, that really can help our health too. Because stress causes inflammation, inflammation causes diabetes, high blood pressure, heart attack, stroke, oh, I mean, so many things. So I could go on and on about inflammation, but we really like to get rid of inflammation, and these things I've mentioned so far, like the hydration, etc., toxin release, all of those really important to decrease inflammation. The other thing is to watch what you're putting in your body with regard to the food that you're eating. So my last Facebook Live, I talked about things for your brain and certain foods you should eat for your brain. And I mentioned a book by Lisa Mosconi that's really cool about how to keep your brain in best shape as possible and what foods you should be eating for that. So please check out the blog post about that. But in there she does talk about omega-3 fatty acids. She also talks about tart cherries, blueberries that are high in antioxidants. So it's really, when you think about what are the simple things we can do to make our health the best we can, it really comes down to getting enough hydration, getting proper food, getting enough sleep, really important, giving the body the nutrients it needs, the minerals, the vitamins, the omega-3s, etc., and also controlling stress. The other aspect that's really important, which is why Amazing Over 40 is amazing, right, is because it's community. The more we connect with others and have social interaction, the better it is for our brain. So during COVID was a really stressful time for, I think everyone would say it was a stressful time. We didn't have time to really be able to talk to people. Yes, we could be on Zoom calls, etc., but it wasn't, still you didn't feel like that sense of community. Whereas with Facebook Live and the Amazing Over 40 community, we can interact with each other. We have a global community. We can have women from all over the world be joining us. Like we have from Virginia, which is so cool that we have Kim with us from Virginia, and many others that are from San Diego, but other parts of the country. Eventually, I'd like to have everyone from international sites be joining us too. The time zones might be somewhat of an issue, but we'll work it out. And also, I love to do retreats. So social connection is very, very important for our brains. I think that they found a lot of studies that found that with COVID, there are a lot more women who are depressed, more anxiety, a lot more social isolation and loneliness. So social connections are really important. So that's why being here with me, having your friends, going out for, let's say, walk with your friend around the neighborhood, maybe sharing a glass of wine with your friends at happy hour, in moderation, correct? It really helps your brain and helps your entire health. So I'd like to keep it simple, like I said before, and it really just comes down to a few really basic steps that can keep you healthy and happy. So with that, I'm going to see if there's any more questions that we have. Erica, yes, Erica's from Canada. Go Canadians, yes. Thank you, Erica. And any of you else who want to show where you're from, that's awesome. Any last minute questions, please let me know. I like to be respectful of your time. So these are half-hour segments. If for some reason we get into a discussion that needs to go beyond that, we can sometimes do that. But in general, I want to keep to the 30 minutes. Excuse me. Oh, Teresa, Central Pennsylvania. Oh my God, this is awesome. So I like to keep respectful of your time so that we can cover things that we want to make sure we cover, but also that you know that when we're done, you can join me the next, second, and fourth Thursday of each month so we can do the Facebook Lives. And again, this is the time, but I'm here for you to ask your questions, to join me. Please have your friends also join on if they want. These will be recorded and they will be posted on my website. So even if you missed it and you want to watch it again, or you want to review the things I've covered, right? Erica, Teresa, Kim, all the others here with us today, you can go back and listen to the recording. You can share it with your friends, your family, anyone who wants to know about how to live their best life at late 30s, 40s, 50s, 60s, 70s, 80s, and beyond. Yes, I had a patient come the other day and she was in her late 70s. She says, well, I'm not amazing over 40, I'm 70. I said, that's exactly what I'm saying. 40, 50, 60, 70, 80, 90s, whatever age you are, we're here for you because that's what we're all about. How to be the best community with education, inspiration, and then also exploration of all the things we want to do in our lives. So with that, I'm going to conclude. Thank you so much for joining me. I'm Dr. Diana Hoppe. I'm the founder of Amazing Over 40, and I go by Dr. Diana with those blog posts and such. So please join me on the second and fourth Thursday of next month. We'll be talking about different topics, and please let me know if you have certain topics you want me to discuss, because I can definitely do that and answer questions if you want to submit those also to me. So with that, I want to remind everyone, please join me next time, the second and fourth Thursdays at 5:30 Pacific Standard Time. And as always, remember, stay amazing. All right, take care, everyone. Have a wonderful evening, and I'll see you next time.